Hello and welcome. Today we're diving deep into a condition that affects a crucial part of your urinary system, ureteritis. Ureteritis is the inflammation of the ureters, the tubes that carry urine from your kidneys to your bladder. Join us as we explore its causes, symptoms, diagnosis, and management, empowering you with a better understanding of this condition. So, what causes ureteritis? The most common culprit is a bacterial infection that has spread from the bladder, a condition known as cystitis, or the kidneys, known as pyelonephritis. These infections can irritate and inflame the ureteral walls. However, ureteritis can also arise from other factors. These include kidney stones that cause irritation or blockage within the ureters, exposure to radiation therapy targeting the pelvic area, or even certain sexually transmitted infections like chlamydia and gonorrhea. Rarer causes can involve chemical irritants or, in very rare cases, even tumors affecting the ureter. Let's break down the pathophysiology of ureteritis. When the ureter becomes inflamed, the lining or mucosa becomes red and swollen. This inflammation disrupts the normal peristaltic contractions, the wave-like movements that propel urine downwards. This disruption can lead to a backup of urine, increasing pressure within the ureter and potentially affecting the kidney. Prolonged inflammation can also damage the ureteral walls, leading to scarring and narrowing of the ureter, a condition known as ureteral stricture. This stricture can further impede urine flow, potentially causing kidney damage. Unfortunately, precise figures on the epidemiology of ureteritis alone are difficult to obtain, as it often occurs in conjunction with other urinary tract infections like cystitis or pyelonephritis. Therefore, the occurrence of ureteritis is often bundled within the statistics for these broader UTI categories. What we do know is that women are generally more susceptible to UTIs, and therefore are also at a higher risk of developing ureteritis as a secondary infection. Individuals with underlying conditions like diabetes, kidney stones, or a compromised immune system are also more likely to experience ureteritis. Recognizing the signs and symptoms of ureteritis is key for prompt treatment. Common symptoms include flank pain, which is pain in the side or back, potentially radiating towards the groin. You might also experience dysuria, or painful urination, and increased urinary frequency and urgency. The urine may appear cloudy or contain blood, a condition called hematuria. If the infection has spread to the kidneys, you might also develop a fever, chills, nausea, and vomiting. It's important to note that some individuals, particularly those with mild cases, may not experience any noticeable symptoms at all. Diagnosing ureteritis typically involves a comprehensive approach. Your doctor will start with a thorough medical history and physical examination. A urine analysis is crucial to identify the presence of bacteria, white blood cells, and blood in the urine. A urine culture helps identify the specific bacteria causing the infection and determine the most effective antibiotic. In some cases, imaging studies like an intravenous pyelogram (IVP), a CT scan, or an ultrasound may be ordered to visualize the ureters and kidneys, rule out other conditions like kidney stones or blockages, and assess the extent of the inflammation. While ureteritis itself isn't typically classified into distinct types, it can be described based on its cause, such as infectious ureteritis versus ureteritis caused by kidney stones. It can also be classified as acute, meaning it has a sudden onset and short duration, or chronic, indicating a persistent or recurring inflammation. The severity of the condition can also be a differentiating factor. Understanding the underlying cause is paramount in determining the best course of treatment. The primary goal of treatment is to eliminate the underlying cause of the inflammation. In the case of bacterial infections, antibiotics are the mainstay of treatment. The specific antibiotic used will depend on the bacteria identified in the urine culture. Pain relievers can help manage discomfort. Adequate hydration is crucial to flush out bacteria and toxins from the urinary system. If kidney stones are the cause, treatment may involve pain management, medications to help dissolve the stones, or procedures to remove them. In rare cases where there is significant ureteral blockage or damage, surgery might be necessary. Preventing ureteritis largely involves preventing the conditions that cause it. Good hygiene practices, such as wiping front to back after using the toilet, can help prevent UTIs. Drinking plenty of fluids helps to flush out bacteria. Frequent urination, especially after sexual activity, can also help prevent bacteria from ascending into the urinary tract. Prompt treatment of bladder and kidney infections is essential to prevent their spread to the ureters. For individuals prone to kidney stones, dietary and lifestyle modifications, as well as medications, may be recommended to reduce the risk of stone formation. The prognosis for ureteritis is generally good with prompt and appropriate treatment. Most cases resolve completely with antibiotics. However, if left untreated, ureteritis can lead to more serious complications, such as kidney damage, sepsis, or recurrent UTIs. Recent research has focused on developing more targeted antibiotics and exploring alternative therapies for UTs. Advances in imaging techniques are also improving the diagnosis and management of ureteral disorders. As research continues, we can expect even better diagnostic and treatment options for ureteritis in the future. Thank you for joining us today. Remember to consult your healthcare provider for any health concerns.